Hi, I'm Dr. Obiti, and today's topic of discussion is what I wouldn't recommend as a plastic surgeon. So over time, I've seen so many patients who come and have been to other doctors. With all due respect, everybody has their own way of treating a patient. You have to always remember to see the core specialty of the doctor you're going to go to. If your doctor is a surgeon, you should see if they have a certificate of completing a residency in surgery. That's the only way, and they've passed their exams. That's the only way they can label themselves as a certified and qualified plastic surgeon. If they're an aesthetic physician, they must have done certifications or a diploma, short courses after MBBS. If they're a dermatologist, then obviously they do dermatology. So please remember that everybody has a different way of doing things. So the aesthetic medicine is a field where everybody's coming in and doing treatments up to their abilities. So obviously everybody's going to use their own skill set to deliver the results. Ultimately, a patient, in my opinion, a patient should be informed that what I can achieve as a surgeon or what I can achieve as a non-surgical expert or as a dermatologist. So I've seen a lot of people who try to do, for example, nose threads. I think they're horrible. They're a disaster. They cause a lot of scarring. The nose tissue is not something which you should be putting in these kind of substances into. I don't believe it. I believe thread lifts work. They really help to lift a jowl if you're not ready for surgery and to stimulate collagen and buy some time before a proper facelift. Please understand, aesthetic medicine, where aesthetic medicine ends, aesthetic surgery begins. So you have to understand that there's a limitation what you can achieve non-surgically. Second thing I don't like is brow threads. So if you're trying to lift brows, like fox eye trend, horrible. The skin is very thin in the temple area. It shows, it causes scarring. It looks really, really awkward. Multiple skin products. If you're using people come to me and they lay out there one by one, this is my Korean skincare and I'm going to get glass skin. That's not going to work. I'm honestly speaking, the right active ingredients with a proper bespoke skincare plan, a skincare regime which is combining treatments and products. If you can use all the products in the world, you're not going to get improvement. For example, you're using an eye cream, it's not going to make those lines, those crow's feet go away. You might need Botox to soften the lines. You're using retinol, all good, but there's a certain amount of work it can do. You need things which are going to stimulate collagen and give even a better result. So please remember to trust the doctor if they're recommending good treatments as well. I also would not recommend listening to a lot of influencers who are advising skincare or skincare treatments. Please remember, a lot of these can be funded. There's a very big difference between information and knowledge. And I think we're getting a lot of stuff which is being said, which has no scientific evidence. My practice is not like a cookie cutter approach. I don't do the exact same thing for every single person. I will give them a plan which is good for them, suitable for them, and they should follow that plan, and surely they will inshallah see results. Thank you.